Question 1. Governance review demonstrates that the organization's current disability management policies have not been updated in over 5 years. The review highlights a potential disconnect between these policies and the most recent amendments to the relevant provincial/state disability and human rights legislation. The disability management team is tasked with recommending a course of action. Which of the following represents the most appropriate and legally compliant approach? Option A. Initiate a review of the existing policies to identify areas of ambiguity and propose minor clarifications, without a comprehensive overhaul, to avoid significant disruption. Option B. Conduct a series of internal workshops to gather feedback from various departments on how they currently manage disability cases, and then draft new policies based on this collective feedback. Option C. Prioritize updating policies that address the most frequently occurring disability types, as identified in recent HR reports, to streamline the process for common scenarios. Option D. Immediately revise all disability management policies to fully align with the latest legislative amendments, ensuring that all accommodations and procedures meet or exceed the statutory requirements. Correct answer is D. Immediately revise all disability management policies to fully align with the latest legislative amendments, ensuring that all accommodations and procedures meet or exceed the statutory requirements. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the disability management professional to navigate a complex interplay between organizational policy, legislative requirements, and individual employee needs. The challenge lies in ensuring compliance with the governing legislation, while also upholding the principles of fairness, equity, and support for employees with disabilities. Misinterpreting or misapplying the legislation can lead to legal repercussions for the organization and detrimental outcomes for the employee. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the legislative framework as the absolute foundation for policy development and implementation. This aligns with the Certified Professional in Disability Management (CPDM) exam's emphasis on understanding and applying relevant laws and regulations. Specifically, adhering to the governing legislation ensures that the organization's policies are legally sound, non-discriminatory, and provide the minimum required protections and accommodations for employees with disabilities. This approach fosters a culture of compliance and ethical responsibility, safeguarding both the employee and the organization. Incorrect approach is analysis. An approach that focuses solely on organizational policy without explicit consideration of the governing legislation is professionally unacceptable. This is because organizational policies, while important, are subordinate to and must be consistent with legislative mandates. Failure to align with legislation can render policies invalid and expose the organization to legal challenges. An approach that relies on informal discussions and ad hoc decisions without reference to established policies or legislation is also professionally unsound. This creates an environment of inconsistency and potential bias, failing to provide a clear and equitable process for managing disability-related issues. It lacks the accountability and transparency required by regulatory frameworks. An approach that prioritizes expediency or cost-saving measures over legislative compliance is a significant ethical and regulatory failure. While efficiency is desirable, it cannot come at the expense of legal obligations and the rights of individuals with disabilities. Such an approach demonstrates a disregard for the law and a lack of commitment to inclusive and supportive workplace practices. Professional reasoning. Professionals in disability management should employ a decision-making framework that begins with a thorough understanding of the applicable legislative and regulatory landscape. This understanding forms the bedrock upon which all organizational policies and practices are built. When faced with a situation requiring policy review or development, the process should involve 1. Identifying all relevant legislation and guidelines. 2. Assessing current organizational policies against these legal requirements. 3. Developing or revising policies to ensure full compliance and to promote best practices in disability management. 4. Implementing policies with clear communication and training for all stakeholders. 5. Regularly reviewing and updating policies to reflect changes in legislation or best practices. Question 2. Market research demonstrates that successful disability management programs are characterized by effective collaboration among key stakeholders. Considering the Certified Professional in Disability Management (CPDM) role within the specified regulatory framework, which of the following approaches best reflects a comprehensive and compliant strategy for managing an employee's disability claim and return-to-work process? Option A, an approach that focuses on the employee's individual capacity to return to work without significant employer or healthcare provider involvement, assuming the employee will self-advocate for necessary accommodations. Option B, an approach where the insurer dictates the pace and nature of medical treatment and rehabilitation, with limited input from the employee or employer, focusing primarily on cost containment. Option C, a proactive, integrated approach that emphasizes open communication, shared responsibility, and coordinated efforts between the employee, employer, healthcare providers, and insurers, ensuring all actions are aligned with the employee's recovery plan and regulatory requirements. Option D, an approach that prioritizes the employer's immediate operational needs and productivity targets, with the employee expected to manage their return to work independently once medically cleared. The correct answer is C, a proactive, integrated approach that emphasizes open communication, shared responsibility, and coordinated efforts between the employee, employer, healthcare providers, and insurers, ensuring all actions are aligned with the employee's recovery plan and regulatory requirements. Explanation: this scenario is professionally challenging because effective disability management hinges on the coordinated efforts of multiple stakeholders, each with distinct roles, responsibilities, and perspectives. Navigating these differing priorities and ensuring clear communication is crucial for successful return-to-work outcomes and compliance with relevant legislation. The Certified Professional in Disability Management (CPDM) must balance the needs of the employee, the operational requirements of the employer, the clinical expertise of healthcare providers, and the financial and administrative obligations of insurers, all within the specific regulatory framework governing disability management in the relevant jurisdiction. The correct approach represents best professional practice because it prioritizes a collaborative and integrated strategy that aligns with the principles of effective disability management and the regulatory intent. This approach acknowledges the interconnectedness of stakeholder actions and emphasizes proactive communication and shared responsibility. It ensures that all parties are working towards a common goal of supporting the employee's recovery and safe return to work, while adhering to legal and ethical obligations. This aligns with the CPDM role as a facilitator and expert in navigating complex disability cases. An incorrect approach that focuses solely on the employer's immediate operational needs without adequate consideration for the employee's recovery plan or the input of healthcare providers would fail to meet the ethical and regulatory requirements for supporting injured or ill workers. This could lead to premature return to work, re-injury, or a failure to provide reasonable accommodations, potentially violating disability discrimination laws and best practice guidelines. Another incorrect approach that prioritizes the insurer's cost containment measures above all else, potentially delaying necessary medical treatment or rehabilitation services, would also be professionally unacceptable. This disregards the healthcare provider's clinical judgment and the employee's right to timely and appropriate care, contravening ethical principles and potentially legal obligations to facilitate recovery. A third incorrect approach that isolates the employee, expecting them to independently manage their return-to-work process without adequate support from the employer, healthcare providers, or insurers, would be a significant failure. This neglects the employer's duty of care and the collaborative nature of successful disability management, leading to potential negative outcomes for the employee and increased costs for all parties involved. The professional decision-making process for similar situations involves a systematic assessment of the employee's condition, the employer's capacity, the available medical and rehabilitation resources, and the relevant insurance provisions. It requires active listening, clear communication, and a commitment to a multidisciplinary approach. Professionals must continuously refer to the specific regulatory framework, ethical codes, and best practice guidelines to ensure all actions are compliant and promote the well-being of the employee and the efficiency of the disability management process. Question 3. Cost-benefit analysis shows that implementing a comprehensive, multifaceted assessment process for disability needs is more expensive upfront than utilizing a single, generic questionnaire. However, the long-term costs associated with inadequate accommodations, such as prolonged absences and potential litigation, are significantly higher when a superficial assessment is conducted. Considering the regulatory framework for disability management, which approach to assessing disability needs is most ethically and professionally sound? Option A. Utilizing a combination of validated functional capacity evaluations, interviews with the employee and their treating physician, and a review of job-specific tasks to develop a tailored accommodation plan. Option B. Employing a standardized, low-cost questionnaire that provides a broad overview of functional limitations, followed by a review of available job descriptions to identify potential matches for accommodations. Option C. Implementing a brief, online assessment tool that focuses primarily on the employee's ability to perform core job functions, with the understanding that further assessments will be conducted only if significant issues arise. Option D. Relying on the employee's self-reported limitations and the employer's existing knowledge of the role to determine necessary accommodations, with minimal external assessment. The correct answer is B. Employing a standardized, low-cost questionnaire that provides a broad overview of functional limitations, followed by a review of available job descriptions to identify potential matches for accommodations. Explanation: this scenario presents a professional challenge because it requires balancing the employer's financial considerations with the employee's right to a fair and comprehensive assessment of their disability needs. The Certified Professional in Disability Management, CPDM, must navigate the tension between efficiency and thoroughness, ensuring that the chosen assessment tools are not only cost-effective, but also ethically sound and legally compliant within the specified regulatory framework. The core of the challenge lies in selecting tools that accurately identify all necessary accommodations without unduly burdening the employer or compromising the employee's privacy and dignity. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment that aligns with the principles of disability management and relevant regulations. This approach ensures that the assessment is comprehensive, considering the employee's specific functional limitations, the demands of their role, and potential accommodations. It adheres to the ethical obligation to act in the best interest of the employee, while also being mindful of the employer's resources, fostering a collaborative and supportive environment for return to work. This aligns with the CPDM role in facilitating effective disability management through appropriate assessment methodologies. An incorrect approach that relies solely on readily available, low-cost checklists without further investigation fails ethically and regulatorily by potentially overlooking critical needs. This can lead to inadequate accommodations, resulting in further health issues for the employee, reduced productivity, and potential legal challenges for the employer. Violates the principle of providing reasonable accommodations by not conducting a thorough assessment. Another incorrect approach that involves using a single, standardized assessment tool for all disabilities, regardless of their nature, is also flawed. This can lead to misdiagnosis or incomplete understanding of the disability's impact, failing to identify specific needs, and thus not meeting the regulatory requirement for individualized assessment. A third incorrect approach that prioritizes speed and minimal data collection over accuracy and completeness risks creating an incomplete picture of the employee's needs, potentially leading to inappropriate or insufficient accommodations, which is both ethically questionable and non-compliant with the spirit of disability management legislation. Professionals should employ a decision-making framework that begins with understanding the specific context of the employee's situation and the nature of their disability. This involves identifying the most appropriate assessment tools based on the suspected or diagnosed condition, considering both the depth of information required and the resources available. The process should involve consultation with the employee, their healthcare providers, and relevant stakeholders to ensure a comprehensive understanding of functional limitations and potential accommodations. The chosen tools should be evidence-based and validated, allowing for a thorough and objective evaluation. Finally, the assessment findings must be translated into actionable recommendations that are both effective for the employee and feasible for the employer, always within the bounds of legal and ethical guidelines. Question 4. The control framework reveals that an employee has requested an extended leave of absence, citing a personal health issue that is impacting their ability to perform their job duties. The employee has provided a brief note from their physician stating the need for time off, but has not provided detailed medical information. As a certified professional in disability management, CPDM, operating under U.S. federal regulations, what is the most appropriate initial action to take to ensure compliance with the Family and Medical Leave Act, FMLA? Option A. Deny the leave request due to insufficient medical documentation. Option B. Immediately approve the leave request to avoid any potential FMLA violations. Option C. Request detailed medical records directly from the employee's physician without using the FMLA certification form. Option D. Request a completed FMLA medical certification form from the employee's healthcare provider to verify the serious health condition. The correct answer is D. Request a completed FMLA medical certification form from the employee's healthcare provider to verify the serious health condition. Explanation. The control framework reveals a common challenge in disability management, balancing an employee's need for protected leave with an employer's operational requirements and legal obligations. This scenario is professionally challenging because it requires a nuanced understanding of the Family and Medical Leave Act, FMLA provisions, specifically regarding the definition of a serious health condition and the employer's responsibilities in verifying such conditions. A disability management professional must navigate these complexities to ensure compliance, support the employee, and maintain business continuity. Careful judgment is required to avoid misinterpreting FMLA eligibility or improperly denying leave, which can lead to legal repercussions and damage employee trust. The correct approach represents best professional practice because it adheres strictly to the FMLA requirements for verifying a serious health condition. This involves requesting appropriate medical certification from the employee's healthcare provider. This process ensures that the leave requested is indeed for a qualifying reason under the FMLA, thereby protecting both the employee's rights and the employer's compliance. By following the established procedures for medical certification, the disability management professional demonstrates a commitment to fair and lawful administration of leave benefits, which is a cornerstone of ethical and effective disability management. An incorrect approach that involves immediately approving the leave without any verification fails to uphold the employer's right to confirm the FMLA eligibility. This could lead to the misuse of protected leave and potentially impact operational efficiency without proper justification. Another incorrect approach, which is to deny the leave outright based on a perceived lack of severity without following the FMLA certification process, is a direct violation of the Act. The FMLA outlines specific criteria for what constitutes a serious health condition and requires employers to follow a defined process for verification. Failing to do so exposes the employer to significant legal risk, including potential lawsuits for interference with FMLA rights. A third incorrect approach, which is to request information beyond what is permitted by the FMLA for medical certification, infringes upon the employee's privacy rights and can also lead to legal challenges. The FMLA specifies the type of information that can be requested from a healthcare provider. The professional reasoning process for similar situations should begin with a thorough understanding of the employee's request and the applicable regulations, in this case, the FMLA. The next step is to identify the specific FMLA provisions relevant to the situation, such as the definition of a serious health condition and the employer's right to medical certification. The professional should then initiate the legally prescribed process for obtaining the necessary information, ensuring all requests are compliant with privacy laws and FMLA guidelines. Throughout this process, clear and consistent communication with the employee is crucial, informing them of their rights and responsibilities. If there are any ambiguities or complexities, consulting with legal counsel specializing in employment law is a prudent step to ensure full compliance and mitigate risk. Question 5. Operational review demonstrates that an employee is returning to work after a prolonged absence due to a complex medical condition. The disability management team is tasked with developing a safe and effective return-to-work plan. Which of the following approaches best aligns with regulatory requirements and professional best practices for assessing and managing the associated risks? Option A. Conduct a formal risk assessment that identifies potential workplace hazards, evaluates their impact on the employee's specific condition and job duties, and informs the development of tailored accommodations and controls. Option B. Rely on the employee's verbal assurance of their readiness to resume full duties, assuming their condition has resolved sufficiently for them to perform their job without modification. Option C. Implement a standard, predefined return-to-work program that is applied uniformly to all employees returning from medical leave, regardless of their individual circumstances or job roles. Option D. Defer the risk assessment entirely to the employee's treating physician, assuming they will provide all necessary guidance without direct input from the employer's disability management team. The correct answer is A. Conduct a formal risk assessment that identifies potential workplace hazards, evaluates their impact on the employee's specific condition and job duties, and informs the development of tailored accommodations and controls. Explanation: this scenario is professionally challenging because it requires a disability management professional to balance the employer's need for operational efficiency with the employee's right to a safe and supportive work environment, all while adhering to specific regulatory requirements. The core of the challenge lies in accurately assessing the risks associated with an employee's return to work after a significant health event, ensuring the assessment is comprehensive, objective, and legally defensible. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based risk assessment that directly informs the development of a tailored return-to-work plan. This aligns with the principles of proactive disability management, which aim to minimize the impact of disability on both the individual and the organization. Regulatory frameworks, such as those governing workplace health and safety and human rights, mandate that employers take reasonable steps to ensure the safety and well-being of their employees. A thorough risk assessment is the foundational step in fulfilling this obligation, allowing for the identification of potential hazards, the evaluation of their severity, and the implementation of appropriate controls. This approach is ethically sound, as it respects the employee's dignity and capacity, while also addressing legitimate business concerns. An incorrect approach that focuses solely on the employee's perceived ability without a formal, documented risk assessment fails to meet regulatory obligations. This could lead to a breach of duty of care, potentially exposing the employer to legal liability if the employee is injured or their condition exacerbates due to an inadequately managed return to work. Ethically, it is also problematic as it relies on subjective judgment rather than objective data, potentially leading to discriminatory practices or overlooking crucial safety considerations. Another incorrect approach that relies on a generic, one-size-fits-all return-to-work protocol, without considering the specific nature of the employee's condition or the demands of their role, is also professionally unacceptable. This fails to acknowledge the individualized nature of disability and the need for personalized accommodations. Such an approach may violate anti-discrimination legislation by not providing reasonable adjustments, thereby creating an inequitable work environment. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate a comprehensive assessment process, gathering relevant medical information and understanding the employee's functional limitations. 2. Conduct a thorough job analysis to understand the physical, cognitive, and psychosocial demands of the role. 3. Perform a formal risk assessment, identifying potential hazards and evaluating the likelihood and severity of harm in the context of the employee's condition and job duties. 4. Collaborate with the employee, their healthcare provider, and relevant stakeholders to develop a mutually agreed-upon, individualized return-to-work plan that incorporates appropriate accommodations and controls. 5. Establish a system for ongoing monitoring and review of the plan, making adjustments as necessary. 6. Ensure all documentation is accurate, objective, and compliant with all applicable regulations. Question 6. Risk assessment procedures indicate that an employee has been absent for an extended period due to a chronic health condition that is impacting their ability to perform their core job duties. The employee has expressed concerns about their long-term work capacity. Based on the regulatory framework and guidelines for the Certified Professional in Disability Management, CPDM, exam, which of the following represents the most appropriate initial step for the disability management professional? Option A. Initiate a formal interactive process to assess the nature and extent of the employee's limitations and explore potential reasonable accommodations. Option B. Advise the employee that their prolonged absence due to a health condition may necessitate termination of employment due to inability to perform essential functions. Option C. Classify the employee's condition as a temporary medical issue and manage it solely through standard sick leave policies without further investigation into accommodation needs. Option D. Recommend that the employee seek alternative employment outside the organization, as their current role is no longer feasible. The correct answer is A. Initiate a formal interactive process to assess the nature and extent of the employee's limitations and explore potential reasonable accommodations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the disability management professional to navigate the nuanced definition of disability within the specific regulatory framework of the Certified Professional in Disability Management, CPDM, exam's jurisdiction. The challenge lies in distinguishing between a temporary health condition that impacts work and a disability that triggers specific legal protections and management obligations. Misinterpreting this distinction can lead to inappropriate interventions, potential legal repercussions, and failure to support the employee effectively. Correct approach analysis. The correct approach aligns with the foundational principles of disability management as defined by relevant legislation and best practices within the CPDM jurisdiction. It recognizes that a disability, in this context, is not merely a health issue, but a condition that substantially limits one or more major life activities, including the ability to perform essential job functions, and requires accommodation. This approach emphasizes a proactive, individualized assessment to determine if the employee's condition meets the legal definition of disability, and if so, to initiate the interactive process for reasonable accommodation. This is best professional practice because it adheres to legal mandates, promotes employee well-being, and ensures fair and equitable treatment. Incorrect approaches analysis. One incorrect approach fails to acknowledge the legal and regulatory definition of disability, treating all health-related absences as equivalent. This overlooks the specific rights and protections afforded to individuals with disabilities, potentially leading to a failure to provide necessary accommodations and violating anti-discrimination laws. Another incorrect approach might prematurely assume a disability without a proper assessment, leading to unnecessary or inappropriate interventions. This can be intrusive, stigmatizing, and may not address the actual needs of the employee, potentially creating new challenges or undermining trust. A third incorrect approach might focus solely on the employee's inability to perform their current role without considering the broader scope of their abilities or potential accommodations. This narrow focus can lead to a premature conclusion about the employee's employability and fail to explore solutions that would allow them to remain in the workforce. Professional reasoning. Professionals should employ a structured decision-making process that begins with understanding the specific legal and regulatory definitions of disability applicable to their jurisdiction. This involves gathering information about the employee's condition, its impact on their ability to perform job functions, and their potential need for accommodations. The process should then involve engaging in an interactive dialogue with the employee to explore possible solutions, always prioritizing fairness, respect, and adherence to legal requirements. When in doubt, consulting with legal counsel or subject matter experts is a crucial step. Question 7. Compliance review shows that the return-to-work program's success is primarily being measured by the number of employees who have physically returned to their job duties, regardless of their ongoing functional capacity or the duration of their sustained employment. Which of the following approaches best reflects a comprehensive and ethically sound evaluation of return-to-work success? Option A. Measuring success by the absence of any new formal complaints or claims filed by the employee after their return. Option B. Considering an employee successfully returned to work if they are physically present at their workstation for at least 50% of their scheduled hours. Option C. Relying solely on the employee's self-reported feeling of being back to normal and satisfied with their return to work. Option D. Evaluating success based on a combination of sustained job retention, objective performance metrics, and the absence of recurrent absences or re-injury within a defined period. The correct answer is D. Evaluating success based on a combination of sustained job retention, objective performance metrics, and the absence of recurrent absences or re-injury within a defined period. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of return-to-work (RTW) program effectiveness beyond simple presence or absence of an employee. Challenge lies in discerning true success from superficial compliance, particularly when dealing with potentially complex or long-term disability cases. Careful judgment is required to identify indicators of sustainable reintegration versus temporary or incomplete recovery. The correct approach represents best professional practice because it focuses on objective, measurable outcomes that align with the goals of disability management and RTW programs, which are to facilitate a safe, timely, and sustainable return to productive employment. This approach prioritizes the employee's long-term well-being and functional capacity, as well as the employer's operational needs, by looking at factors like job retention, performance, and absence recurrence. This aligns with the ethical obligation to promote employee health and safety and the professional responsibility to ensure programs are effective and evidence-based. An incorrect approach that relies solely on the employee's physical presence in the workplace fails to acknowledge that RTW is a process, not just a destination. An employee may be physically present but unable to perform their duties effectively, leading to potential safety risks, reduced productivity, or a higher likelihood of re-injury or relapse. This approach is ethically problematic as it prioritizes a superficial metric over the employee's actual functional capacity and well-being, potentially leading to a detrimental outcome for both the employee and the employer. It also fails to meet the professional standard of evaluating program effectiveness based on meaningful results. Another incorrect approach that focuses only on the absence of new claims or formal complaints overlooks the subtle signs of ongoing struggle or dissatisfaction. Employee might be hesitant to report issues due to fear of reprisal or a desire to appear capable, even if they are experiencing difficulties. This approach is ethically deficient because it ignores potential underlying problems that could escalate, and it fails to proactively address barriers to full reintegration. Professionally, it represents a failure to conduct a comprehensive evaluation of RTW success. A third incorrect approach that solely considers the employee's self-reported satisfaction with their return, without corroborating objective data, is also professionally inadequate. While employee satisfaction is a component of a successful RTW, it is subjective and can be influenced by factors unrelated to functional capacity or job performance. Relying solely on this metric can lead to an inaccurate assessment of program effectiveness, potentially masking underlying issues that could impact long-term employment. This approach lacks the rigor required for a professional evaluation and can be ethically misleading if it doesn't reflect the reality of the employee's functional capabilities and workplace integration. The professional reasoning process for similar situations should involve a multifaceted evaluation. This includes defining clear, measurable RTW success criteria upfront, such as sustained attendance, performance metrics, and functional capacity assessments. It requires ongoing monitoring that goes beyond simple presence, incorporating feedback from the employee, supervisor, and treating healthcare providers. Professionals should also consider the duration of successful RTW, looking for sustained reintegration rather than short-term returns. Finally, it involves a critical analysis of the data collected to identify trends, potential barriers, and areas for program improvement, ensuring that the evaluation is both comprehensive and ethically sound. Question 8. Stakeholder feedback indicates that communication regarding return-to-work plans is often perceived as unclear, inconsistent, and lacking in proactive updates, leading to anxiety and confusion among employees and managers. As a certified professional in disability management, CPDM, which of the following strategies would be most effective in addressing this feedback and improving stakeholder communication? Option A. Send out a single, comprehensive policy document outlining all return-to-work procedures and expect stakeholders to refer to it as needed. Option B. Minimize communication to only essential updates to avoid overwhelming stakeholders with information, assuming they will ask questions if they require further clarification. Option C. Rely on managers to disseminate information as they deem appropriate, assuming they have the necessary context and communication skills to convey complex return-to-work details effectively. Option D. Implement a structured communication protocol that includes regular, scheduled updates via multiple channels, e.g., email, secure portal, brief in-person check-ins, providing tailored information based on individual roles and responsibilities, and offering clear points of contact for questions. The correct answer is D. Implement a structured communication protocol that includes regular, scheduled updates via multiple channels, e.g., Email, secure portal, brief in-person check-ins, providing tailored information based on individual roles and responsibilities, and offering clear points of contact for questions. Explanation. This scenario presents a common challenge in disability management, balancing the need for timely and effective communication with diverse stakeholders who have varying levels of understanding and different priorities. The professional challenge lies in ensuring that communication is not only informative but also empathetic, compliant with relevant regulations, and fosters trust and collaboration. Careful judgment is required to select communication strategies that address the specific feedback received, while upholding the principles of professional disability management. The correct approach represents best professional practice because it directly addresses the identified feedback by proposing a multifaceted communication strategy. This strategy prioritizes clarity, accessibility, and tailored information delivery, which are fundamental to effective stakeholder engagement in disability management. It acknowledges the need for proactive updates and the importance of providing resources, aligning with ethical obligations to keep individuals informed and supported. Furthermore, it implicitly supports compliance with any applicable privacy regulations by focusing on appropriate information sharing and consent. An incorrect approach that focuses solely on a single, generic communication channel fails to acknowledge the diverse needs of stakeholders. This could lead to information being missed or misunderstood, potentially violating ethical duties to ensure comprehension and access to information. It might also inadvertently breach privacy regulations if sensitive information is disseminated without appropriate safeguards or consent. Another incorrect approach that relies on reactive, ad hoc communication demonstrates a lack of proactive engagement. This can create an impression of disorganization or a lack of commitment, undermining trust and potentially leading to missed opportunities for early intervention or support. Ethically, it falls short of the duty of care expected in disability management. An incorrect approach that prioritizes brevity over clarity risks oversimplifying complex information, which can lead to misinterpretations and dissatisfaction among stakeholders. This can be particularly problematic when dealing with sensitive disability-related matters, where precise understanding is crucial for informed decision-making and access to appropriate support. It may also fail to meet regulatory requirements for clear and understandable communication. The professional decision-making process for similar situations should involve a thorough analysis of stakeholder feedback, identification of specific communication gaps, and consideration of the diverse needs and preferences of all involved parties. Professionals should then develop a communication plan that is proactive, transparent, tailored, and compliant with all relevant legal and ethical standards. This plan should include mechanisms for feedback and continuous improvement. Question 9. System analysis indicates that an employee, after a prolonged absence due to a chronic back condition, has provided a doctor's note stating they can return to work with restrictions on lifting and prolonged standing. The employer's primary operational need is for a role that requires frequent heavy lifting and standing for extended periods. Which of the following approaches best navigates this situation in accordance with best practices for return-to-work programs? Option A. Initiate a dialogue with the employee and their healthcare provider to understand the specific limitations and explore potential modifications to the job duties or work environment that would allow for a safe and effective return, while also assessing if alternative roles exist within the organization that align with the employee's current capabilities. Option B. Assign the employee to a temporary, less demanding task that is not part of their regular duties, without consulting their doctor or the employee about the suitability of this task or its long-term implications. Option C. Require the employee to provide extensive personal medical records beyond what is necessary to understand their functional limitations and accommodation needs before considering any return-to-work options. Option D. Inform the employee that their restrictions prevent them from performing the essential functions of their current role, and that their employment will be terminated if they cannot return without restrictions. The correct answer is A. Initiate a dialogue with the employee and their healthcare provider to understand the specific limitations and explore potential modifications to the job duties or work environment that would allow for a safe and effective return, while also assessing if alternative roles exist within the organization that align with the employee's current capabilities. Explanation. This scenario presents a common challenge in disability management, balancing the employer's operational needs with the employee's right to reasonable accommodation and a safe return to work. The professional challenge lies in interpreting and applying the relevant legislation and guidelines to a specific nuanced situation, ensuring both compliance and a supportive outcome for the employee. Careful judgment is required to avoid discrimination, uphold privacy, and facilitate a sustainable return to work. The correct approach represents best professional practice because it prioritizes a collaborative, evidence-based process that aligns with the principles of disability management and relevant legislation. It involves engaging directly with the employee and their healthcare provider to understand the limitations and necessary accommodations, while also considering the essential functions of the role and potential modifications. This approach respects the employee's autonomy and medical privacy, fosters trust, and aims for a mutually beneficial outcome that supports both the individual's well-being and the organization's operational requirements. It is grounded in the ethical obligation to provide reasonable accommodation and prevent discrimination. An incorrect approach that focuses solely on the employee's inability to perform the job without exploring accommodations fails to meet the legal and ethical obligations to explore reasonable adjustments. This could lead to a finding of discrimination. Another incorrect approach that imposes accommodations without consulting the employee or their medical provider violates privacy rights and may result in ineffective or inappropriate accommodations, potentially exacerbating the employee's condition or hindering their recovery. An approach that prioritizes business needs above all else, disregarding the employee's medical condition and the duty to accommodate, is a direct contravention of disability discrimination legislation. Professionals should employ a decision-making framework that begins with understanding the employee's condition and limitations through open communication and appropriate medical documentation. This should be followed by an assessment of the essential functions of the job and a proactive exploration of potential reasonable accommodations. The process should be iterative, involving ongoing dialogue with the employee and their healthcare team, and documented thoroughly to ensure transparency and compliance. Question 10. Compliance review shows that a disability management program is being evaluated for its adherence to current regulatory frameworks. The program's historical context and evolution are being considered. Which of the following approaches best reflects an understanding of how historical legislative developments have shaped contemporary disability management practices within this jurisdiction? Option A. Emphasizing the foundational principles of non-discrimination and reasonable accommodation established by early landmark disability rights legislation, as these continue to inform current legal obligations and ethical considerations. Option B. Adopting the latest recommendations from disability advocacy groups, irrespective of their direct alignment with the current statutory and regulatory framework. Option C. Prioritizing the most recent amendments to disability-related statutes, assuming they supersede all previous legislative intent and practice. Option D. Relying exclusively on the administrative guidelines issued by a single government agency responsible for disability services, without cross-referencing the primary legislative acts. The correct answer is A. Emphasizing the foundational principles of non-discrimination and reasonable accommodation established by early landmark disability rights legislation, as these continue to inform current legal obligations and ethical considerations. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a nuanced understanding of how historical legislative shifts have impacted current disability management practices within the specified jurisdiction. The challenge lies in accurately identifying which legislative era's principles are most relevant to contemporary issues, demanding more than a superficial knowledge of disability law. Professionals must discern the foundational principles that continue to inform current frameworks, even as specific statutes evolve. This requires careful judgment to avoid anachronistic applications of outdated legal concepts or misinterpreting the intent behind foundational disability legislation. Correct approach analysis. The correct approach accurately reflects the enduring influence of early disability rights legislation that established fundamental principles of non-discrimination and reasonable accommodation. These foundational principles, often rooted in the historical context of civil rights movements and subsequent landmark legislation, continue to underpin modern disability management frameworks. They emphasize the inherent dignity of individuals with disabilities and the societal obligation to remove barriers to participation. This approach represents best professional practice because it acknowledges that, while specific regulations and administrative procedures may change, the core ethical and legal imperatives established by earlier legislation remain critical for effective and compliant disability management. Adherence to these foundational principles ensures that current practices are ethically sound and legally defensible, promoting inclusivity and equal opportunity. Incorrect approach is analysis, an approach that solely focuses on the most recent amendments without considering the foundational principles' risks, overlooking the established legal precedents and ethical underpinnings that guide current practices. This can lead to a superficial understanding that might miss the broader intent of disability legislation. For instance, focusing only on recent procedural changes might neglect the fundamental right to accommodation established decades prior, potentially leading to noncompliance with the spirit, if not the letter, of the law. Another incorrect approach would be to exclusively rely on the administrative guidelines of a specific agency without grounding these in the overarching legislative framework. While administrative guidelines provide practical implementation details, they are subordinate to the primary legislation. Over-reliance on these can lead to practices that, while compliant with the agency's specific directives, may not fully align with the broader legal obligations established by Parliament or Congress, potentially creating legal vulnerabilities. Finally, an approach that prioritizes the recommendations of advocacy groups without critically assessing their alignment with the current legal and regulatory framework is also flawed. While advocacy groups play a vital role in shaping policy and practice, their recommendations must be evaluated against the established legal requirements. Adopting recommendations that exceed or misinterpret legal obligations can lead to operational inefficiencies or unintended legal consequences. Professional reasoning. Professionals should approach this by first identifying the core legislative acts that establish disability rights and protections within the jurisdiction. They should then trace the evolution of these acts, noting significant amendments and their impact on the principles of accommodation, non-discrimination, and return to work. Understanding the historical context allows for a more robust interpretation of current regulations and best practices. This involves consulting primary legal sources, legislative histories, and authoritative legal commentary. When faced with evolving legislation, professionals must engage in a continuous learning process, seeking to understand how new provisions build upon or modify existing legal obligations. This analytical framework ensures that disability management practices are not only procedurally correct, but also ethically grounded and legally sound, reflecting a deep understanding of the historical trajectory of disability rights. Question 11. Process analysis reveals that a disability management professional is assisting an employee in a state with unique disability definitions and accommodation procedures that differ from federal guidelines. The professional must determine the employee's eligibility for benefits and necessary accommodations. Which of the following approaches best adheres to the regulatory framework for this specific state? Option A. Focusing on the employer's internal policies and procedures, assuming they are sufficient to meet all legal obligations under state law. Option B. Applying the definitions and procedures outlined in the state's disability statutes and relevant case law, ensuring all actions are compliant with these specific state mandates. Option C. Prioritizing administrative efficiency by using generalized best practices for disability management, even if they do not precisely align with the state's specific legal wording. Option D. Relying solely on the definitions and procedures established by federal disability laws, assuming they encompass all state-specific requirements. The correct answer is B. Applying the definitions and procedures outlined in the state's disability statutes and relevant case law, ensuring all actions are compliant with these specific state mandates. Explanation. This scenario presents a professional challenge due to the inherent complexity of navigating state-specific disability laws and regulations, which can vary significantly in their definitions of disability, eligibility criteria, and required accommodations. A certified professional in disability management, CPDM, must exercise careful judgment to ensure compliance and provide equitable support to individuals. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment that directly aligns with the specific legal framework of the relevant state. This involves understanding the state's definition of disability, the procedural requirements for establishing eligibility, and the employer's obligations regarding reasonable accommodations as mandated by that state's statutes and case law. Adhering to these specific legal mandates ensures that the disability management process is legally sound, ethically responsible, and effectively supports the employee's rights and needs within the established regulatory boundaries. An incorrect approach that relies solely on federal definitions without considering state-specific nuances is professionally unacceptable. This is because federal laws like the Americans with Disabilities Act, ADA, set a baseline, but states can enact laws that provide greater protections or have different procedural requirements. Failing to account for these state-specific variations can lead to non-compliance, denial of benefits or accommodations that are legally due under state law, and potential legal challenges for the employer. Another incorrect approach that ignores the specific wording of state statutes and instead relies on general industry best practices is also professionally unacceptable. While best practices are valuable, they cannot supersede legal requirements. If a state law dictates a specific process or definition, deviating from it based on general best practices, even if well-intentioned, constitutes a regulatory failure. This can result in legal repercussions and a failure to uphold the rights guaranteed by state law. A third incorrect approach that prioritizes administrative efficiency over legal accuracy is equally problematic. While streamlining processes is desirable, it must not come at the expense of legal compliance. Misinterpreting or overlooking state-specific legal requirements for the sake of speed can lead to significant legal and ethical breaches, potentially disadvantaging the individual seeking disability management support. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the governing jurisdiction. 2. Thoroughly research and understand the specific disability laws, regulations, and relevant case law of that jurisdiction. 3. Conduct an individualized assessment of the employee's condition and needs, referencing the definitions and criteria established by the applicable state laws. 4. Determine eligibility and appropriate accommodations based strictly on the state-specific legal framework. 5. Document all assessments, decisions, and actions, ensuring they are clearly linked to the relevant state legal provisions. 6. Seek legal counsel when complex or ambiguous legal issues arise. Question 12. Assessment of how a disability management professional should respond when an employee with a newly diagnosed chronic condition requests a modified work schedule, citing fatigue and cognitive fog as primary limitations impacting their ability to perform essential job functions. The employee has provided a doctor's note stating the diagnosis and recommending adjustments to work demands. Option A. Immediately implement a temporary modified schedule based on the employee's initial request without further discussion, assuming it will resolve the issue. Option B. Initiate a formal interactive process with the employee to discuss their specific limitations, explore potential modifications to their work schedule or duties, and document all discussions and proposed accommodations. Option C. Share the employee's diagnosis and the doctor's note with the employee's direct supervisor and team members to foster understanding and support. Option D. Inform the employee that their request cannot be accommodated due to the general nature of the doctor's note and the potential impact on team productivity. The correct answer is B. Initiate a formal interactive process with the employee to discuss their specific limitations, explore potential modifications to their work schedule or duties, and document all discussions and proposed accommodations. Explanation. This scenario presents a common challenge in disability management, balancing an employee's request for accommodation with the employer's operational needs and legal obligations under the Americans with Disabilities Act, ADA. The professional challenge lies in navigating the interactive process effectively, ensuring a reasonable accommodation is provided without causing undue hardship to the employer, and maintaining confidentiality and respect for the employee. Careful judgment is required to assess the limitations, explore potential accommodations, and document the process accurately. The correct approach represents best professional practice because it directly engages the employee in the interactive process as mandated by the ADA. This process is a collaborative effort to identify the precise limitations resulting from the disability and to explore potential reasonable accommodations that would enable the employee to perform the essential functions of their job. Documenting this process thoroughly demonstrates good faith efforts to comply with the ADA and protects both the employee and the employer. It prioritizes open communication and problem solving, which are ethical imperatives in disability management. An incorrect approach that fails to engage the employee in a meaningful interactive process violates the spirit and letter of the ADA. Simply denying a request without exploring alternatives or seeking further information is a regulatory failure. Another incorrect approach that involves disclosing the employee's medical information to colleagues without consent is a clear violation of privacy and ethical standards, and potentially a breach of confidentiality laws. An approach that imposes an accommodation without employee input or consideration of its effectiveness for the employee's specific limitations bypasses the core principle of the interactive process and may not result in a truly effective accommodation, leading to potential legal challenges and employee dissatisfaction. Professionals should approach such situations by initiating a structured interactive process. This involves meeting with the employee to understand their limitation, discussing potential accommodations, and exploring the feasibility of each option. Documentation of all communications, proposed accommodations, and reasons for acceptance or rejection is crucial. When in doubt, consulting with legal counsel or a disability management specialist can provide guidance on navigating complex situations and ensuring compliance with all applicable regulations. Question 13. Process analysis reveals a situation where an employee has requested a modified work schedule due to a newly diagnosed medical condition. The employee has provided a general statement about needing adjustments, but has not offered specific details about their diagnosis or limitations. As a certified professional in disability management, what is the most appropriate next step to ensure compliance with legal and ethical obligations while facilitating a reasonable accommodation? Option A. Inform the employee that without a specific diagnosis and detailed medical report, no accommodations can be considered, and they must return to their full duties. Option B. Ask the employee's direct supervisor for their observations regarding the employee's performance and any perceived limitations to inform the accommodation decision. Option C. Request a meeting with the employee to discuss their needs and limitations. Explain the process for obtaining medical documentation to support accommodation, and obtain their consent to contact their healthcare provider for specific, relevant information. Option D. Directly contact the employee's treating physician to inquire about the nature of their condition and any recommended work restrictions, explaining that this is necessary for workplace adjustments. Correct answer is C. Request a meeting with the employee to discuss their needs and limitations, explain the process for obtaining medical documentation to support accommodation, and obtain their consent to contact their healthcare provider for specific, relevant information. Explanation. This scenario is professionally challenging because it requires balancing an employee's right to privacy and accommodation with the employer's need to manage workplace safety and productivity. The certified professional in disability management, CPDM, must navigate complex legal and ethical considerations without overstepping boundaries or violating established regulations. The core challenge lies in gathering sufficient, relevant information to make informed decisions about accommodations while respecting the employee's dignity and confidentiality. The correct approach represents best professional practice because it prioritizes a collaborative, information-gathering process that is grounded in legal requirements and ethical principles. It involves direct, respectful communication with the employee to understand their needs and limitations, and then engaging with healthcare professionals through appropriate channels to obtain necessary documentation. This approach ensures that decisions are evidence-based, compliant with disability management legislation, and uphold the employee's rights. An incorrect approach that involves directly contacting the employee's treating physician without the employee's explicit consent or a clear, documented process for such contact would be a significant regulatory and ethical failure. This violates patient privacy laws and erodes trust. Another incorrect approach, such as making assumptions about the employee's capabilities or the nature of their disability without sufficient information, demonstrates a failure to adhere to the principles of reasonable accommodation and can lead to discriminatory practices. Furthermore, relying solely on anecdotal information or the opinions of colleagues rather than documented medical evidence, and direct communication with the employee and their healthcare providers is unprofessional and legally precarious. Professionals should employ a systematic decision-making framework that begins with understanding the employee's reported limitations. This is followed by a clear explanation of the need for medical documentation to support accommodation requests, emphasizing confidentiality and the purpose of the information. The process should then involve obtaining the employee's consent to contact their healthcare provider or requesting specific documentation from the employee. Throughout this process, maintaining open communication, respecting privacy, and adhering strictly to legal and ethical guidelines are paramount. Question 14. The performance metrics show a consistent delay in the resolution of disability claims and a higher than average rate of employee dissatisfaction with the disability management process. Considering the critical importance of effective communication and collaboration in managing these claims, which of the following approaches best addresses these performance issues while adhering to best practices in disability management? Option A. Minimize communication with the employee to only essential updates, directing all other inquiries to HR to streamline the process. Option B. Rely primarily on informal verbal updates between the disability management professional and the employee's direct manager to keep them informed of claim progress. Option C. Implement a standardized communication protocol that clearly defines roles, responsibilities, and preferred communication channels for all stakeholders, including the employee, manager, HR, and healthcare providers, ensuring all interactions are documented. Option D. Focus on expediting information flow by encouraging managers to directly contact healthcare providers for updates, bypassing the employee and the disability management professional. The correct answer is C. Implement a standardized communication protocol that clearly defines roles, responsibilities, and preferred communication channels for all stakeholders, including the employee, manager, HR, and healthcare providers, ensuring all interactions are documented. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the need for timely and effective communication with the legal and ethical obligations to protect sensitive employee information. The disability management professional must navigate potential conflicts between different stakeholders' needs and perspectives, ensuring all parties are informed appropriately without breaching confidentiality or violating privacy regulations. The pressure to demonstrate progress through performance metrics can sometimes lead to shortcuts in communication processes, making adherence to best practices crucial. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a structured, documented, and inclusive communication strategy. By establishing clear communication channels and protocols, the disability management professional ensures that all relevant parties, employee, manager, HR, and healthcare providers, as appropriate, receive consistent and accurate information. This proactive approach fosters trust, facilitates informed decision-making, and supports the timely return to work. It aligns with ethical principles of transparency and respect for individual privacy, while also meeting the practical demands of managing a disability claim effectively. Adherence to established protocols ensures compliance with any applicable privacy legislation and organizational policies. Incorrect approaches analysis. One incorrect approach fails by solely relying on informal, ad hoc communication. This lacks documentation, can lead to misinterpretations, and creates a risk of information being missed or inaccurately conveyed. It bypasses established protocols, potentially violating privacy by sharing information without proper consent or through unauthorized channels. This approach is ethically unsound as it does not guarantee consistent and accurate information dissemination, and it fails to provide a clear audit trail, which is often a regulatory requirement. Another incorrect approach is to prioritize the manager's immediate demands over the employee's privacy and the established communication process. This can lead to the disclosure of sensitive medical information without the employee's explicit consent, a direct violation of privacy laws and ethical standards. It undermines the trust essential for a successful return-to-work process and can create legal liabilities for the organization. This approach demonstrates a lack of understanding of the disability management professional's role as a neutral facilitator and protector of employee rights. A third incorrect approach involves communicating solely through the employee, without involving other necessary stakeholders like HR or the manager, even when their input is critical for accommodation planning or return-to-work coordination. This creates communication silos, delays decision-making, and can result in a failure to implement appropriate accommodations or support mechanisms. It neglects the collaborative aspect of disability management, which requires input from multiple parties to ensure a holistic and effective outcome, and can lead to a breakdown in the support system for the employee. Professional reasoning. Professionals should adopt a decision-making framework that begins with understanding the specific needs of the employee and the organizational context. This involves identifying all relevant stakeholders and their roles. Next, a professional must consult and adhere to established communication protocols, organizational policies, and relevant privacy legislation. The process should be documented at each stage, ensuring transparency and accountability. When faced with conflicting demands or pressures, the professional must prioritize ethical considerations, legal compliance, and the well-being of the employee, seeking guidance from HR or legal counsel if necessary. A proactive, structured, and collaborative approach, grounded in respect for privacy and clear communication, is paramount. Question 15. To address the challenge of determining the compensability of a disability claim where an employee has a pre-existing condition that may have been aggravated by a workplace incident, which of the following approaches best aligns with the principles of workers' compensation laws and regulations? Option A. Proceed with approving the claim for the full extent of the disability without a detailed medical review, based solely on the employee's report of a workplace incident. Option B. Conduct a thorough review of all medical documentation to establish the causal relationship between the workplace incident and the employee's current disability, considering the extent to which the incident aggravated any pre-existing condition, and consult with relevant parties to ensure accurate claim adjudication. Option C. Assume the entire disability is due to the pre-existing condition and therefore not compensable under workers' compensation, without further investigation into the work incident's contribution. Option D. Immediately deny the claim upon learning of a pre-existing condition, as this typically absolves the employer of responsibility for any subsequent disability. The correct answer is B. Conduct a thorough review of all medical documentation to establish the causal relationship between the workplace incident and the employee's current disability, considering the extent to which the incident aggravated any pre-existing condition, and consult with relevant parties to ensure accurate claim adjudication. Explanation. The scenario presents a common challenge in disability management, navigating the complexities of workers' compensation claims when an employee's condition may be exacerbated by pre-existing factors. The professional's role is to ensure compliance with relevant workers' compensation laws and regulations, while advocating for the employee's well-being and the employer's responsibilities. This requires a nuanced understanding of causation, apportionment, and the employer's duty to accommodate, all within the specific legal framework governing workers' compensation. The correct approach demonstrates best professional practice by prioritizing a thorough, evidence-based assessment of the work-relatedness of the disability. This involves gathering comprehensive medical documentation, understanding the specific criteria for compensability under workers' compensation statutes, and engaging in a collaborative process with the employee, healthcare providers, and the employer. This approach upholds the principles of fairness and due process inherent in workers' compensation systems, ensuring that benefits are provided when legally mandated and that the employer's obligations are met accurately. It also aligns with ethical obligations to act with integrity and competence. Incorrect approaches fail to adhere to the regulatory framework and ethical standards. One incorrect approach might involve prematurely denying the claim based on the presence of a pre-existing condition, without a proper assessment of whether the work incident aggravated or contributed to the disability. This violates the principle that a pre-existing condition does not automatically preclude a worker's compensation claim if the employment contributed to its worsening. Another incorrect approach could be to assume full responsibility for the condition, without considering the extent to which the work incident was the primary or contributing cause, potentially leading to an overpayment of benefits or an inaccurate claim determination. A third incorrect approach might involve disregarding the employee's input or medical provider's opinion without a valid, legally sound reason, thereby undermining the collaborative process and potentially leading to a dispute. The professional decision-making process for similar situations should involve 1. understanding the specific workers' compensation legislation applicable to the jurisdiction. 2. Conducting a comprehensive factual investigation, including obtaining all relevant medical records and statements. 3. Analyzing the medical evidence to determine the causal link between the work incident and the disability, considering aggravation of pre-existing conditions. 4. Consulting with legal counsel or claims adjusters specializing in workers' compensation if the case presents complex legal or medical causation issues. 5. Communicating clearly and transparently with all parties involved, including the employee, employer, and insurer, regarding the claim status and next steps. 6. Documenting all actions and decisions meticulously. Question 16. Strategic planning requires a comprehensive understanding of how an employee's diagnosed condition impacts their ability to perform essential job functions and the work environment. When an employee reports a new musculoskeletal condition that affects their ability to perform tasks involving prolonged standing and repetitive lifting, what is the most appropriate initial step for a certified professional in disability management, CPDM, to take to ensure effective and compliant support? Option A. Rely solely on the employee's self-report of limitations to determine the necessary accommodations, assuming their description accurately reflects all job demands and potential environmental influences. Option B. Initiate a detailed job analysis to identify the specific physical demands of the employee's role, including the frequency and duration of standing and lifting, and conduct an ergonomic assessment of the workstation and tasks to identify potential risk factors and feasible modifications. Option C. Immediately implement a temporary reassignment to a less physically demanding role within the organization, without a formal assessment of the original job or the new role's suitability. Option D. Focus on the potential cost and administrative burden of implementing accommodations, prioritizing solutions that are least disruptive to current operations, even if they are not the most effective for the employee's condition. The correct answer is B. Initiate a detailed job analysis to identify the specific physical demands of the employee's role, including the frequency and duration of standing and lifting, and conduct an ergonomic assessment of the workstation and tasks to identify potential risk factors and feasible modifications. Explanation. This scenario is professionally challenging because it requires a disability management professional to balance the immediate needs of an employee with a diagnosed condition against the broader organizational requirements for productivity and safety, all while adhering to specific regulatory frameworks. The core challenge lies in accurately assessing the impact of the employee's condition on their job functions and identifying appropriate accommodations that are both effective for the employee and feasible for the employer, without compromising workplace safety or legal compliance. Careful judgment is required to avoid assumptions and to base decisions on objective data and established best practices. The correct approach represents best professional practice because it prioritizes a thorough and objective job analysis and ergonomic assessment. This process, when conducted in accordance with the principles of the Certified Professional in Disability Management, CPDM framework, involves a systematic evaluation of the essential functions of the job, the physical and cognitive demands, and the work environment. It then uses this data to identify specific, evidence-based ergonomic interventions and reasonable accommodations. This aligns with the ethical and regulatory obligations to support employees with disabilities, promote their return to work, and ensure a safe and productive work environment, all while respecting the individual's rights and dignity. The CPDM framework emphasizes a proactive and individualized approach, ensuring that accommodations are tailored to the specific needs of the employee and the demands of the role, thereby minimizing the risk of further injury or performance issues. An incorrect approach that relies solely on the employee's subjective reporting, without objective assessment, fails to meet the regulatory requirement for a comprehensive evaluation. It risks overlooking critical job demands or environmental factors that could contribute to the disability or hinder recovery, potentially leading to ineffective accommodations and a failure to meet legal obligations. Ethically, it may not fully support the employee's return to work, or could lead to a perception of favoritism or inadequate support. Another incorrect approach that focuses only on the employer's perceived cost or inconvenience of accommodations, without a thorough job analysis, is a direct violation of disability management principles and relevant legislation. This approach prioritizes business interests over the employee's right to a reasonable accommodation and a safe working environment. It is ethically unsound and legally indefensible, as it demonstrates a failure to engage in the interactive process in good faith and to explore all viable accommodation options. A third incorrect approach that implements generic, one-size-fits-all solutions without a specific job analysis and ergonomic assessment is also professionally unacceptable. While seemingly efficient, it fails to address the unique demands of the role or the specific limitations of the employee. This can lead to accommodations that are either insufficient, leading to continued difficulties for the employee, or excessive, creating unnecessary burdens for the employer. It demonstrates a lack of due diligence and a failure to apply the principles of individualized assessment central to effective disability management. A professional decision-making process for similar situations should begin with a commitment to understanding the specific job functions and demands through a detailed job analysis. This should be followed by an ergonomic assessment to identify environmental or task-related factors contributing to the disability or posing risks. The interactive process with the employee is crucial to gather their input and understand their limitations and needs. Based on this comprehensive data, potential accommodations should be identified, evaluated for effectiveness and feasibility, and implemented. Ongoing monitoring and review are essential to ensure the accommodation remains effective and to make adjustments as needed, always in compliance with relevant regulations and ethical guidelines. Question 17. Operational review demonstrates that a disability claim has been submitted with a physician's note stating the individual is unable to work for an extended period. However, the note lacks specific diagnostic information, functional limitations, or an estimated return-to-work date. Which of the following actions best aligns with regulatory compliance for disability determination processes? Option A. Informing the claimant that the provided note is insufficient and denying the claim without further investigation or opportunity for the claimant to provide additional information. Option B. Requesting detailed medical documentation from the treating physician, including diagnosis, specific functional restrictions, and prognosis, to ensure the claim meets the established criteria for disability. Option C. Proceeding with the disability determination based on the physician's statement of being unable to work for an extended period, assuming this is sufficient evidence. Option D. Making a determination based on the employer's perception of the claimant's ability to perform their job duties, as the employer is aware of the role's requirements. The correct answer is B. Requesting detailed medical documentation from the treating physician, including diagnosis, specific functional restrictions, and prognosis, to ensure the claim meets the established criteria for disability. Explanation. The scenario presents a common challenge in disability management, balancing the need for timely and accurate disability determination with the imperative to adhere strictly to the regulatory framework governing such processes. Professionals must navigate the complexities of medical evidence, functional capacity assessments, and the specific criteria outlined by the relevant legislation to ensure fair and compliant outcomes. The challenge lies in interpreting often nuanced medical information and translating it into a determination that meets legal standards, while also considering the individual's circumstances and the employer's obligations. The correct approach emphasizes a systematic and evidence-based process that aligns directly with the established regulatory framework for disability determination. This involves a thorough review of all submitted medical documentation, ensuring it addresses the specific criteria for disability as defined by the relevant legislation. It requires engaging with healthcare providers to clarify information or obtain necessary additional assessments, and applying the established guidelines consistently. This approach represents best professional practice because it upholds the integrity of the disability determination system, ensures fairness to the claimant by basing decisions on objective evidence, and mitigates legal and financial risks for the employer by demonstrating adherence to regulatory requirements. It fosters trust and transparency in the process. An incorrect approach that relies solely on the claimant's self-reported limitations without independent medical verification fails to meet regulatory requirements. Disability determination processes are designed to be objective and evidence-based, not solely reliant on subjective statements. This approach risks making determinations that are not supported by medical fact, potentially leading to inappropriate approvals or denials, and exposing the organization to legal challenges. Another incorrect approach that prioritizes expediency over thoroughness by making a determination based on incomplete medical information is also professionally unacceptable. Regulations typically mandate a comprehensive review of available evidence. Rushing the process can lead to errors in judgment, overlooking critical medical factors, and ultimately result in an incorrect determination. This haste can also be perceived as a lack of due diligence, undermining the credibility of the disability management program. Finally, an approach that applies subjective interpretations of medical evidence without reference to established disability criteria or guidelines is problematic. Disability determination is a quasi-legal process that requires adherence to specific definitions and standards. Objectivity introduces bias and inconsistency, making the process vulnerable to challenges and failing to provide a defensible basis for the decision. The professional decision-making process for similar situations should involve 1. Understanding the specific regulatory framework and its definitions of disability. 2. Gathering all relevant and complete medical and functional information. 3. Systematically evaluating the evidence against the established criteria. 4. Seeking clarification or additional information from healthcare providers when necessary. 5. Documenting the entire process and the rationale for the determination. 6. Consulting with legal counsel or subject matter experts if complex or ambiguous situations arise. Question 18. The assessment process reveals that an employee returning from a significant injury has provided medical documentation outlining specific physical limitations that impact their ability to perform certain essential functions of their original role. The employer is concerned about maintaining productivity and has identified a vacant position that appears to be a good fit, but the employee's medical provider has not yet been consulted regarding the specific demands of this new role. Which of the following approaches best facilitates a compliant and effective return-to-work plan? Option A. Inform the employee that their original role cannot accommodate their current limitations and suggest they explore external employment options until they are fully recovered. Option B. Proceed with developing a return-to-work plan based solely on the employer's interpretation of the medical documentation and the perceived requirements of the vacant role, without further consultation. Option C. Proactively engage with the employee's healthcare provider to understand the specific restrictions and how they might apply to the identified vacant role, while also discussing potential accommodations for that role if necessary, to ensure a safe and sustainable return. Option D. Assign the employee to the vacant position immediately, assuming it is a suitable fit based on a general understanding of the role, and address any issues that arise after they have started. The correct answer is C. Proactively engage with the employee's healthcare provider to understand the specific restrictions and how they might apply to the identified vacant role, while also discussing potential accommodations for that role if necessary, to ensure a safe and sustainable return. Explanation. This scenario presents a common challenge in disability management, balancing an employee's medical limitations with the operational needs of the employer while adhering to regulatory frameworks. The professional challenge lies in developing a return-to-work (RTW) plan that is both medically appropriate and practically feasible, ensuring compliance with relevant legislation and ethical considerations. Careful judgment is required to avoid discrimination, uphold employee rights, and facilitate a safe and sustainable return to work. The correct approach represents best professional practice because it prioritizes a collaborative and evidence-based strategy. It involves actively engaging with the employee and their healthcare provider to understand the specific functional limitations and the recommended accommodations. This aligns with the principles of the Americans with Disabilities Act (ADA) in the U.S., which mandates reasonable accommodations unless they impose an undue hardship on the employer. A proactive and individualized approach ensures that the RTW plan is tailored to the employee's needs and the job requirements, fostering trust and a higher likelihood of success. This also aligns with the ethical obligation of a certified professional in disability management to act in the best interests of both the employee and the employer, promoting a healthy and productive work environment. An incorrect approach that focuses solely on the employer's immediate operational needs without adequately considering the employee's medical restrictions would be a regulatory and ethical failure. This could lead to a violation of the ADA by failing to provide reasonable accommodations, potentially resulting in a discriminatory outcome. It also fails to uphold the ethical duty to support the employee's well-being and recovery. Another incorrect approach that relies on assumptions about the employee's capabilities without consulting medical professionals or the employee themselves is also professionally unacceptable. This bypasses crucial information needed to develop an effective RTW plan and could lead to placing the employee in a situation where they are unable to perform the duties safely or effectively, potentially exacerbating their condition or causing further injury. This demonstrates a lack of due diligence and a failure to adhere to best practices in disability management. A professional decision-making process for similar situations involves a systematic approach. 1. Gather comprehensive information, obtain medical documentation, understand the job requirements, and consult with the employee. 2. Identify functional limitations. Clearly define what the employee can and cannot do based on medical advice. 3. Explore reasonable accommodations. Brainstorm potential modifications to the job or work environment that would enable the employee to perform essential functions. 4. Engage in the interactive process. Maintain open communication with the employee and their healthcare provider to discuss options and reach a mutually agreeable solution. 5. Document the process. Keep detailed records of all communications, assessments, and decisions made. 6. Implement and monitor the plan. Ensure the RTW plan is put into action and regularly reviewed for effectiveness and any necessary adjustments. Question 19. Consider a scenario where a certified professional in disability management, CPDM, is tasked with evaluating the effectiveness of their organization's disability management program. The organization has invested significantly in various support services, including early intervention, return-to-work planning, and vocational rehabilitation. The CPDM needs to demonstrate the program's value and identify areas for improvement. Which of the following approaches to measuring outcomes would best align with professional best practices and regulatory expectations for demonstrating program impact? Option A. Gathering informal testimonials from employees about their experiences with the program, without a structured method for data collection or analysis. Option B. Measuring only the average length of time employees remain on disability leave, without assessing their eventual return to work or the success of their reintegration. Option C. Focusing solely on the number of employees who have accessed any disability management service, regardless of their return-to-work status or overall recovery. Option D. Establishing a comprehensive system to track return-to-work rates, the quality of return, e.g., sustained employment, job satisfaction, and indicators of employee health and productivity improvements. The correct answer is D. Establishing a comprehensive system to track return-to-work rates, the quality of return, e.g., sustained employment, job satisfaction, and indicators of employee health and productivity improvements. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a disability management professional to move beyond simply tracking participation in programs to demonstrating the tangible impact of those programs on both employee well-being and organizational objectives. The challenge lies in selecting and implementing outcome measures that are meaningful, reliable, and aligned with the specific goals of the disability management program and the broader organizational strategy. Without robust outcome measurement, it is difficult to justify program effectiveness, secure continued investment, and identify areas for process optimization. This necessitates a deep understanding of both disability management principles and the organization's operational context. Correct approach analysis. The correct approach involves establishing a framework for measuring outcomes that focuses on both return-to-work rates and the quality of that return, alongside indicators of employee health and productivity. This aligns with best practices in disability management, which emphasize a holistic view of outcomes. Regulatory frameworks and ethical guidelines for disability management professionals often implicitly or explicitly require demonstrating program efficacy and responsible stewardship of resources. By measuring return-to-work rates, the program demonstrates its primary function. However, incorporating measures of reduced absenteeism, improved presenteeism, where applicable and ethically measured, and employee satisfaction with support received, provides a more comprehensive picture of success. This approach allows for data-driven decision-making, process optimization, and the ability to articulate the program's value proposition to stakeholders. It also supports the ethical obligation to provide effective and efficient services. Incorrect approach is analysis, focusing solely on the number of employees participating in disability management programs, without assessing their return-to-work status or overall well-being, represents a failure to measure actual program effectiveness. This approach measures activity, not outcomes, and does not provide evidence of the program's impact. It is ethically questionable as it may lead to the continuation of ineffective programs, misallocation of resources, and a lack of demonstrable benefit to employees or the organization. Measuring only the duration of absence for employees in the program, without considering their successful return to work or the factors influencing their recovery, is also insufficient. While duration is a component of absence, it does not capture the ultimate goal of returning employees to productive work in a sustainable manner. This approach risks overlooking instances where employees remain absent for extended periods despite program involvement, or where return to work is not fully successful. Collecting anecdotal feedback from employees without a structured and standardized method for analysis or correlation with program interventions is unreliable. While qualitative data can be valuable, it lacks the rigor needed for objective outcome measurement and can be subject to bias. This approach fails to provide the objective data necessary for program evaluation and improvement, and therefore does not meet professional standards for demonstrating program impact. Professional reasoning. Professionals in disability management must adopt a data-driven approach to outcome measurement. This involves defining clear, measurable objectives for the disability management program that align with organizational goals. The selection of outcome measures should be a deliberate process, considering both quantitative and qualitative indicators that reflect the program's impact on return to work, employee health, and productivity. Regular review and analysis of these outcomes are crucial for identifying trends, assessing program effectiveness, and implementing necessary process optimizations. Professionals should also be aware of relevant ethical codes and any applicable jurisdictional regulations that mandate or guide outcome measurement and reporting. This systematic approach ensures accountability, promotes continuous improvement, and demonstrates the value of disability management services. Question 20. The investigation demonstrates that a long-term employee has been on medical leave due to a complex chronic condition. To facilitate a safe and timely return to work, the Certified Professional in Disability Management, CPDM, needs to understand the employee's current functional capacity and any necessary workplace accommodations. Which of the following approaches best aligns with regulatory requirements and ethical best practices for collaborating with healthcare providers in this situation? Option A. Directly contact the employee's physician to request a comprehensive medical report detailing the employee's diagnosis, treatment plan, and prognosis, without prior employee consent. Option B. Assume the employer has a right to access all medical information related to the employee's absence to ensure a safe return to work and proceed with requesting information from the physician. Option C. Obtain explicit, written consent from the employee to contact their treating physician to discuss functional limitations and potential accommodations relevant to their job duties. Option D. Advise the employee that they must provide all medical documentation directly to the employer, and the employer will determine the necessary accommodations based on this information. The correct answer is C. Obtain explicit, written consent from the employee to contact their treating physician to discuss functional limitations and potential accommodations relevant to their job duties. Explanation. This scenario is professionally challenging because it requires balancing the employee's right to privacy and confidentiality with the employer's need to facilitate a safe and timely return to work. The Certified Professional in Disability Management, CPDM, must navigate complex ethical considerations and regulatory requirements, particularly concerning the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., which governs the privacy of health information. The CPDM role is to act as a liaison, ensuring that necessary information is shared appropriately to support the return-to-work process, without violating privacy laws or compromising the employee's trust. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the employee before engaging with healthcare providers. This aligns with HIPAA core principles, which mandate patient authorization for the disclosure of protected health information. 5. By seeking consent, the CPDM respects the employee's autonomy and legal rights, fostering a collaborative environment. This approach ensures that communication with healthcare providers is targeted, relevant to the return-to-work plan, and legally compliant, thereby minimizing the risk of privacy breaches and potential legal repercussions. An incorrect approach that involves directly contacting the employee's physician without prior consent from the employee is a significant regulatory and ethical failure. This action violates HIPAA by disclosing or requesting PHI without proper authorization, exposing the employer and the CPDM to legal penalties and reputational damage. It also erodes trust with the employee, potentially hindering future cooperation and creating a hostile work environment. Another incorrect approach, such as relying solely on the employee to relay all medical information without direct, authorized communication with the healthcare provider, is also professionally deficient. While respecting privacy, this method can lead to incomplete or inaccurate information, delaying the return-to-work process and potentially resulting in an unsafe return if critical medical limitations are not fully understood. This can also place an undue burden on the employee. A third incorrect approach, assuming the employer has an inherent right to all medical information related to an employee's absence, demonstrates a fundamental misunderstanding of privacy laws and ethical obligations. This assumption disregards the legal protections afforded to employees' health information and can lead to discriminatory practices and legal challenges. The professional decision-making process for similar situations should begin with understanding the specific regulatory framework, e.g., HIPAA in the U.S. The CPDM must then assess the information needed to support a safe and effective return to work. The next critical step is to engage the employee, explain the process, and obtain their explicit, written consent for any communication with their healthcare providers. This consent should specify the scope of information to be shared and the purpose of the communication. If consent is granted, the CPDM can then communicate with the healthcare provider, focusing solely on information relevant to the return-to-work plan, such as work restrictions, accommodations, and estimated return dates. If consent is denied or limited, the CPDM must work within those boundaries, exploring alternative solutions with the employee and employer.